Hi, good morning, and welcome to the ZP Developer Zone. So we like to do this Developer Zone a couple of times a week, and really we like to answer questions that have come in during the week to make sure that really people are getting what we think is the best advice. So let me jump straight into it and say today is the 4th of January. It's approximately 8 a.m. London time, and we like to, as I say, answer the sort of technical questions that have actually come in during the week. That said, let me go forward a bit quicker. Just to say one thing, a lot of what we do these days is on the Sensi-All platform. I won't bear too long on the Sensi-All platform, but there is a webinar on the 24th of January, and I will mention that as well. So the Sensi-All platform really is a kind of OEM solution that kind of says if somebody wants to do an IVD, an in vitro diagnostic, or somebody's trying to do a wearable, we do have those kind of technologies in-house. I would say that the IVD is much more of a sort of turnkey solution, whereas wearables is always harder, and it's essentially slower and more expensive to go. But that said, we do have these two technology foundations in-house. We also have a spectrochemical system or an optical system as well. But at ZP, we are kind of well known for the electrochemistry, so I will focus on electrochemistry today. Now, the philosophy at ZP, and it's linked to that Sensi-All, and it's a link to this entire webinar, actually, is really about getting people to market as quickly as possible. You can have clinicians or patients who require something measured. You know, here I put potassium, urea, ammonium, calcium, pH. And you have developers and entrepreneurs and businesses, and also what they call intrapreneurs, who want to develop technologies so that these people can be served with some sort of sensing technology. So at ZP, we're very keen on getting between the left-hand side and the right-hand side as quickly as possible. So that Sensi-All platform that I brought up earlier on is really part of that philosophy. We kind of describe it as OEM, original equipment manufacturer, because we imagine that businesses will adopt the sensors and the hardware and adapt and take it to market for different applications. So we do have a range of sensors. Now, the nice thing about all of our technologies, or a lot of our technologies, is they're cloud enabled. In fact, I will have, I'll be looking at somebody's data later on this morning. So we have a Julie database. If people are using our sensors and they're using the Sensi-All platform, then the data ends up going to the cloud. And what's quite nice is that the entire raw signal goes to the cloud, so it really helps us with troubleshooting. We do have an API, an application program interface. It allows people to draw data from that cloud across to their cloud as well. And that then means that they're kind of in this cycle. So, because what we're trying to do is get people to out of their labs and out of their facilities and into the hands of real users really quickly. And because it's cloud enabled, you can see what's essentially happening in the field. And then that allows you to iterate and improve things like, when I say algorithm improvement, so for example, the way you extract the concentration from the raw signal may change depending on the matrix or on the application itself, which is a little bit linked to question number 2 later on today, or later on in this webinar. But that's what our whole philosophy at ZP is, to get from technologies from labs into people's hands as quickly as possible, and by making them cloud enabled, we sort of have this faster cycle. It's called a lean startup mentality. So we do have the Sensi-All platform. It's a very nice piece of hardware. In fact, this is that piece of hardware here with the sensor. We do have the whole system connects via what's called a Sensi-All app to the cloud, and we can go between different sensors using QR codes. And I realize we do have a webinar, as I say, on that on the 24th of January. So here's a link. If a link pops up today, by the way, I've already put the links underneath the video on YouTube. So if you sort of navigate over to YouTube, you'll find this video embedded there, and you'll find all these links underneath there as well. Slightly different matter, but we also have a webinar on food sense. Food sense is our technology for measuring ingredients, analytes and ingredients in the food industry. It may be interesting just to kind of see a real world application of our kind of technology. Just take a quick cup of coffee. We do have a whole range of electrochemical sensors, and these will be discussed today, and I won't spare too much time on them, but here's the list of, here's a link to all of our biosensors. So I'll go forward a bit more. Question number 1 is really about biosensors for human health, and question number 2 is reference electrodes. These two questions are actually kind of related, because one of the questions is got to focus on, in an electrochemical sensor, you can have, we often print these electrodes, and you'll end up having a working electrode, a counter electrode, and a reference electrode. So really, most people actually are focused on the working electrode, and question number 2 is actually focused on the reference electrodes. So they're kind of related, these two questions, and so it may be worth or interesting to watch, let's say, both parts of this. But let's go for question number 1, which is biosensors for human health. I just want to say hi to Aftab this morning. Aftab is watching online. He's our representative in India, does an excellent job, very strong engineer with good technical and commercial skills. So thank you, Aftab, for joining this morning. So we've had a list of sensors. We've got the glucose sensor. The first thing to notice is that the quantity is 6. I think the smallest pack size we do in any of these sensors is 10. So that's the first part to say, we can't do pack sizes essentially less than 10. It's just, it doesn't make business sense for us to kind of to ship such a small quantity. So we've got the glucose sensor here. As I go through this list, the glucose sensor is probably the first sensor we started with. It's a side note, but I was at Abbott Diabetes in 2000, so that's when I sort of first made glucose strips. So we have glucose sensors, we have lactate sensors. Lactate sensors is probably our sensor that we've been making the second longest, and we've done a lot of work on lactate sensors. Then we have our sodium sensors, quite a mature sensor. The potassium sensor, which I think is a really mature sensor. Then we have our chloride sensor, our calcium, and I've noticed all the time that these people are interested in both the sensor and the calibration solution, which is good, because there's nothing worse than getting into a new, let's say, collaboration or program, and the people are just using kind of random test solutions. So it is good that people use, in the first instance, sensors, electronics, and test solutions from ZP, because then, we know that they'll all work. There's nothing worse than getting into projects where, and I've had this, where people are kind of inventing electronics and say, oh, your sensor doesn't work. It's like, how do you know your electronics works? Because, the sensors work perfectly well on our electronics, and then they want us to make their electronics work on our sensor, and that's pretty hard. That's called a project, and we do consulting as well, contract development, contract manufacturing. Anyway, the calcium sensor, the pH sensor, which is a good sensor, the urea sensor, and the oxygen sensor. Now on the potentiostat side, I do have slides on each one of these sensors, and I'll make some comments as we go through. On the potentiostat side, we are phasing out the Anapot potentiostats and replacing them with Kate and Emma. Kate is a single channel instrument, and Emma is a 6-channel instrument. So Kate's a 1-channel instrument, and Emma is a 6-channel instrument. And also the GFET. Now I've left the page up on GFET, but I have definitely said on the GFET page, we've replaced it with the single-purpose biosensor circuit. And I realize that that's slightly off your screen at the moment, but GFET is replaced by single-purpose biosensor circuit, but I'll make some comments on that. So I like to just go through these lists just to make sure that I kind of understand what's being asked about. Any links that pop up, I've already put them there. So the glucose sensor, it's a good sensor, it's good to go. As I say, the minimum pack size is pack size 10. I've deliberately put a generation 1 glucose sensor there. I'm not going to get into it in this webinar today, but you do have what's called generation 1 and generation 2 glucose sensors. I've deliberately put a generation 1 glucose sensor there. It's not something I've commented upon today, but we do workshops for large companies where essentially they pay for us to come on site and we do a workshop and do demos, etc. So that's probably a good forum to discuss what we call generation 1 sensors versus generation 2 glucose sensors. But I've looked at your requirements and I agree, you need the calibration solution, which I think I might have missed off there, and you need the glucose sensor as well. So hopefully this is a link to the glucose sensor, but you're right, there is a calibration solution that needs to be ordered as well. So we're kind of good to go on that. The lactate sensor, I've similarly looked it up. Yeah, I can see this time, there is a lactate sensor. It is available in a minimum of a 10 pack. And yes, I agree, use our calibration solution, at least in the first instance. There's nothing worse than jumping into as I say, unknown, uncontrolled solutions. So it's good to get them from us. Sodium sensors, the same. You've asked for both the sensor and the solution, and I've sort of thought about it and checked it. Yep, minimum pack size is 10, but that said, otherwise it's good to go. And you've done the same as well. So this is good, because these people are asking for two sides of the coin here, or two parts of the equation. They're asking for the sensor and they're asking for the test solution that we do. So you can always go into your own solutions later on. But once you start throwing in a variable that's outside of our control, it starts sort of essentially creating not problems, but it does, it requires extra support. So in the first instance, start simple and then get more and more complicated as you go. So for example, if you're making a glucose sensor, test it with buffer to start with, then start testing it with blood, as an example. The chloride sensor, similarly, there is a liquid calibration solution, and the sensors are available in pack sizes of 10. Same with calcium. You're asking for the calibration solution, which is good, and you're asking for 6, but we do pack sizes of 10. It's the same with the pH solution. You're asking for the test solution, and I suppose I've made a recommendation here. This is for our guys in India. Just so I sort of each slide is the kind of image or recommendation, and it basically confirms what they've asked for. Apart from on the pH sensor, there's a bit of ambiguity, so I've sort of said go for this particular sensor. Urea, you listed urea, though you were linking to uric acid, but I really think you mean urea, because I know uric acid, I know urea, I can guess what your application is, so I'd agree you want the urea sensor, pack of 10. And you also were kind enough to you also realized you needed the calibration solution, which is great. And then on the oxygen sensor, we've got packs of 10 there, and also the calibration solution. You didn't ask for ammonia, by the way, but I just sort of highlight that we do have an ammonia sensor as well. So I sometimes when people are interested in urea, and they're interested in things like potassium, and they're interested in things like pH and sodium, then they're often interested in ammonia as well. It's also a marker for some organ functions in the body. In terms of potentiostats, you're asking about that Anna Pot. I'd really like to get you onto Kate, or I'd like to get you onto Emma. I've put a link here, and I've also put a link underneath the video as well. Kate is because if you were trying to do single analyte tests, then Kate is a good device because it looks like a real product, let's say you could give to a consumer. And so the R&D instrument is also very similar to an instrument that you would actually give to an end user. So that's why I like Kate. Emma is becoming basically Emma is this, that if you're really getting into biosensor development work, you have to run in parallel. So you do need to be running lots of tests at the same time. It's probably worth saying that we will only support in the R&D phase our own potentiostats and not those of other people. You were interested in the GFET. So the GFET, I put a link here. The GFET has definitely been, it was a good instrument. I think this was developed 2019, 2018. So good instrument, nothing wrong with it. But we basically shrunk it right down. In fact, you can get a sense of scale here because this is the GFET. And in this, if we take the GFET out, and then this instrument here, the single purpose biosensor circuit, this is the circuit here. So this is the circuit, and this is this is just a breakout board or a docking board. You want to call it evaluation kit, which I think some engineers prefer that term. You can get a sense of scale, which is also, I think, a good reflection on electrochemistry in general. That actually, it's one of the smallest, I would say, sets of electronics you can drive a sensor with. Now, what I mean by that is, if I was to talk about a spectroscopic instrument, the electronics and the housing required to make an optical or spectroscopic measurement are larger and more difficult and more power requirement than an electrochemical one. Anyway, that's a slight tangent. You're asking about a GFET. The GFET got discontinued, but it has been replaced by the single purpose biosensor circuit. I've put a link to it there. They are definitely shipping all around the world, including into India. In fact, one just got through customs recently into India. So any links, I've also put the links underneath the video as well. So my advice is a bit like this. Look, you've asked for a range of sensors from glucose to oxygen. They're available in packs of 10. I put potassium in the middle because that happens to be in the middle. My sort of advice is get them, but don't run into the lab and start using all of these sensors. My advice would be maybe to start with potassium and start with glucose, because you have to kind of, if you rush in and do lots and spread yourself thin across lots of sensor types, it can give you lots of learning. But if you get in and do glucose and potassium, the reason I bring up glucose and potassium, we do hold, as I say, on-site workshops, or also people come to Norway and attend workshops in Norway. Glucose is an amperometric sensor and potassium is an ion selective electrode. So it kind of gives you two sides of the same coin. I realize that actually anyone who comes to one of our workshops in Norway or any of our corporate workshops, everyone makes a glucose sensor and everyone makes an oxygen sensor and everyone tests a potassium sensor, by the way. So that's just an FYI. It might be a nice way of, even if you've got our hardware, of, let's say, getting some real expert hands-on advice, is have either come to a workshop at ZP or have us come on site and do a workshop. Now, oh yeah, that's right. Sometimes when people are asking for multiple analytes like this, they're often thinking about having multiple tests on one system. We do that. This is an example here of a kind of credit card where, we've put something like 6 tests in a row. It's a microfluidic device. You can see the colors changing here. And what's happening is basically there's a kind of food coloring here, and it's running down these channels, and then it's filling up this device. So we are capable of putting sensors into one particular platform, but we do that as a sort of project. We have what calls mini projects, micro projects, proof of principles type of projects. So my advice is don't do too much. Don't go onto too many sensors all at once in the lab. Just choose maybe glucose and potassium and start with those, and then start expanding outwards. Otherwise, you're kind of overwhelmed with learning. Question number 2 is already about reference electrodes. So the first questions were really about the working electrode. Now I'm going to talk about reference electrodes. So it's not discussed too much, but when you're measuring a potentiometric sensor, which is an ion selective electrode, is an example of a potentiometric sensor. You measure this potential and you say, the potential is proportional. For in the case of potassium, the potential is proportional to the potassium. Great, everyone's happy. But there is a little bit of a thing that can go on, is that the reference electrode is assumed to be stable in that case. Now, most of the time the reference electrode is stable. So lots of the time we're using silver chloride. People are using it in buffers where the chloride concentration is fixed, so 150 millimolar, for example. But in the real world, you may not always be able to rely on that chloride being fixed. So the whole assumption is that you've got this reference electrode, which is silver chloride, but that chloride is assumed to be fixed, and therefore you've got a what's called fixed potential. But actually, that might not be the case. But actually, you do find out that often it is the case. So if you look at a blood glucose meter, in fact, I realize now that that's not got a silver chloride electrode on it, but they once upon a time did. At the beginning of the 90s, they definitely did. They worked, and because in fact the chloride concentration there in that blood is quite controlled. It's about 135 millimolar, so it works perfectly fine. I suppose a stronger example is actually this CGM, this continuous glucose monitor here. These work perfectly well. These happen to be amperometric, and they work perfectly well because the interstitial chloride concentration, or the chloride concentration in the interstitial fluid, is quite controlled. So don't overthink that this is a problem everywhere, but it's just to say that it can be a problem, and I will talk about where it could be a problem in a bit. So most of the time they have a kind of they have an inherent potential of their own, which is linked to the chloride in blood, and a lot of bodily fluids. Like when I mean lot of interstitial fluid and blood, plasma, serum, it's about 135 millimolar. Now at ZP, we do, in some applications, or sometimes we do end up converting our reference electrode from what we would call a pseudo reference, where the chloride is only controlled by the solution. So one of the guys here is asking, can we put our systems into a flow cell? So let me just do a quick. I'm just going to bring in the website very quickly. Go to products. Go to accessories. So the quick question just came in. So these are some of the flow adapters that we have. So the quick answer is ZP does have the ability to put sensors, there's a video here, into what's called a flow cell. So in this particular video, I'm just answering a question that came in online whilst I was talking. So here we've got a flow cell. The guy is screwing in the sensor at the moment. And I suppose here you would need an nanopot because the nanopot is all set up for this. So I can see the flow cell here. I can see him screwing in that sensor. So he's actually got a valve system here as well. So in answer to the question, can you use our sensors in a flow cell? All the sensors that I've listed out today, I'm just making sure, yeah, they've all got we immobilize our reagents upon the electrodes so they don't get washed away. So you can have a system where you can flow over the top. It's true, they are using the nanopot potentiostat here, and he is using one of our flow cells. So the quick answer to your question is you can use our sensors in flow cells. And if you want to have this kind of idea where you flow a solution over the surface of the sensor, you get a response, you then flow a wash solution over it, you get, and then maybe you do a calibration, you can do that. That would be, if I was trying to make a continuous system in a kind of either hospital or at home system, and I wanted it to be very accurate, then I would think I would be doing that. That is at least something we thought about ourselves, and so I do have notes around that. So the quick answer to your question is most of our sensors, especially the ones we discussed today, which is including glucose, lactate, oxygen, sodium, potassium, urea, pH was in there as well. I added ammonium in there. They're all able to be used in a flow cell. And yeah, the idea that you would have a sensor in a flow system, flow the liquid over the top of it, and then have calibration routines. Yeah, that's the way I would do it if I was trying to make a very accurate system. Back to the reference electrode. Sometimes if the reference electrode, we need to protect it, we put an extra layer on top of the reference electrode, and this is to fix the chloride concentration in place. Now the reality is that you can't fix the chloride in place. It does actually eventually sort of diffuse away. So I just put a discussion here, which is if you're in the blood, then I wouldn't overthink this, by the way, but because I think there the chloride is quite fixed. But for example, in the past, we would have thought it was a good idea to actually load up the reference electrode with loads of chloride so that we had this kind of reservoir of chloride. I'm realizing now that over the last couple of years, I've really changed my thinking on this a little bit. Because what can happen then is you can load it up, and if you put it into a solution that's very low in chloride, chloride is a very mobile anion. It's quite small, singly charged. You can't hold it in place. It's going to diffuse away. So what happens is it diffuses away, and at which point then the chloride concentration on that electrode can diminish. At which point its reference potential changes. I've shown it here, going from sort of, if you go from 1 molar to 150 millimolar, the reference potential can change quite a bit by something like 125 millivolts, which would really mess up a potassium sensor and even a glucose sensor because the potential is not fixed. Don't overthink it, because not in every application this is a problem. And I always say to people, don't try and fix a problem that you don't have, because people say, oh, this could happen, and then they can think of all the things that could happen. But of course, if you're really doing medical device development, you do have to do a whole risk assessment, and that's what we do with our clients, to make sure that there are real problems and there's perceived problems, and we end up only solving the real problems. But this could be a scenario. So a scenario would be you've got a reference electrode, you fix the chloride above it in at 1 molar, but you're putting it in blood, and blood is at 135 millimolar. So the chloride is going to start dissolving away from that. So that would be a bad scenario to test. They have some specific questions. Do we have some other ideas apart from silver chloride? We do. I don't want to mix up question number 1 and question number 2 here. So I wouldn't want to mess up question number 1 with question number 2. But specifically to question number 2, we do have other materials available. If it wasn't silver chloride, we could use copper For example, we do, and I put a link here. Are our silver chloride reference electrodes solid state? They are. They're not liquid. Do you have a estimated lifetime? No, I don't have an estimated lifetime. I understand the question, but I don't know what the rate of diffusion of chloride away from those electrodes is. I think I did a back of the envelope calculation really last night, and I did a quick check on it this morning. I think we're putting about 4 micromoles. I'm making sure, so not micromolar, micromoles of chloride on there. So you can do a sort of calculation and think, if I've got a reasonable diffusion rate, you know, how quickly is that potential going to change? I wouldn't necessarily, in future, if somebody asked me to make a true reference as opposed to a pseudo reference, I wouldn't necessarily be using the techniques that we would have done 2 years ago. But we can decrease the chloride during production, and this is what I would suggest as well. If you really need a true reference electrode, and don't think on question number 1, shouldn't assume that they do need a true reference electrode. They probably get away with a pseudo reference electrode, especially if they spoke to us in a kind of in a consulting, because then I could advise them directly. But anyway, question number 2, your question is, can you do a chloride? Can we change the chloride content? Yes, we can. I think that's a good idea. Are we capable of producing alternatives on this scale? Yes. I mean, it's easy enough to do different chloride concentrations, and we're also capable of doing different material sets altogether. And we have been quite interested in doing other material sets as well. So if I was trying to make a chlorides, if I was chloride concentration in seawater, I put here 0.536, so maybe I'm right. So if I was making a reference electrode for different applications, I would look at what the actual chloride was in those applications, and then we would be fixing it at that case. So I think urine is one of the ones that you'd think about a little bit, because urine concentration, the chloride can go from 110 to 250 millimoles, so that might be a good one. I'd never really bother with blood because I think the chloride's quite fixed. Sweat is actually quite subtle, at least 40 to 60 millimolar. Have to really think about how much you really need to do that. Seawater, I think it's quite fixed anyway, so I wouldn't not sure if I was to bother even going for a true reference. I might stick with a pseudo reference, but if I was going to make one of our chloride resilient electrodes, then I'd probably fix it at this kind of concentration. So question number 1, biosensors for human health. Right, so we have the electrodes. We prefer to use the Kate and the EMA potentiostat, but you did mention flow cells. So in that case, I would be going for an EMA potentiostat with those flow cells. And I do understand your question, because I would be the same. If I was trying to make an instrument that was fairly accurate for monitoring patients, I would also be having a flow cell flowing their sample of interest over that sensor, and then having a calibration routine to routinely check it. So the quick answer is all of our sensors the formulations are essentially immobile. I know what you mean, because if you use a normal glucose strip, the enzyme just gets washed away and you've essentially got one usage on it. Question number 2, the answers to your questions: yes, we can do other materials. Yes, we can change the chloride appropriately. I think you've got about 4 micromoles of chloride on there, and I would agree that potentially now, in retrospect, you would want to go in with a chloride concentration that was kind of more similar to what the application was expected to be at, rather than just loading it up high, because it just basically, the bigger the difference in concentration, the faster the rate of escape of that chloride is going to be. So nice idea, but I think it needs refining. So I want to say thank you. If you've got any questions on ZP, don't hesitate to reach out to us, including our friends in India. If you've got further questions, just drop them by. I do another webinar on Sunday, so maybe I'll slip something in there as well. Otherwise, if you've got any questions, don't hesitate to reach out to us. Okay, thanks so much. Take care. Bye.